There may soon be an easier way to test for coronavirus antibodies, and it's all thanks to a new test developed by Johns Hopkins researchers. WJZ is live. Kelsey Kushner explains how this test works and how it could be a tool in fighting this pandemic. Kelsey.
Vic, imagine a test that is a little less invasive than getting your blood drawn. Well, scientists say that they can actually detect antibodies from COVID-19 in your saliva just 14 days after exposure. Researchers at Johns Hopkins Bloomberg School of Public Health are studying a new tool to detect COVID-19 antibodies, saliva.
It's highly sensitive and it's specific as well to those components of the novel coronavirus.
The test uses a small sample of a person's saliva with results that can be obtained in just hours. Chris Heaney with Johns Hopkins says it's less invasive than a blood sample antibody test. Saliva samples are collected using a sponge placed in a person's mouth for over a minute. Researchers say the results are highly accurate and can help give them a broader picture of populations exposed.
I would totally be interested in seeing if I have had COVID in the past.
I think a lot of people are, because even my sister who's all for getting tested, she hasn't gotten tested because she's scared it's going to be painful.
Heaney says the test is also capable of identifying those without antibodies as well as people who are asymptomatic. And using a test like this could help researchers predict what's to come.
As we transition into the period when vaccines do become available, it could be important to understand population immunity through a tool like this, through saliva, as vaccines are deployed.
Now, researchers say that this test is still being studied. Their goal is to eventually make it available to the public. Reporting live tonight, Kelsey Kushner for WJZ.